Hello, good morning. It is about 9 a.m. where I am. I am kind of just getting up myself. I wanted to make this video like 2 days ago and my internet was not working. Actually, I think Wednesday I started trying to make this video, but the internet was not working. Thursday it was hit and miss. I was busy Friday. Saturday I wanted to do it. Internet was not working great again. And then Sunday my laptop died. It's just one of those things. So, I'm going to sip my coffee while I do this. I'm still half asleep, so bear with me. It's going to be really fun while I pronounce all these names. Okay, so we're moving on. This is video 7, or episode 7, of the adverse events of special interest released from Pfizer BioNTech in regards to the COVID-19 vaccine. Again, I always like to say a little bit of a disclaimer. I am not a medical professional. I am not allowed, nor will I give advice medically. Your body, you do what you want with it. If you want to get vaccinated, if you don't want to get vaccinated, I don't care. I really don't. It's none of my business. People who are getting upset either way, if you're mad that people are getting vaccinated or you're mad that people aren't getting vaccinated, it is literally none of your business. So calm down. Stop buying into the CBC rhetoric or NBC or wherever you are in the world watching mainstream media. They're lying to you. I bought their lies in the beginning. It's okay. You know what? We all get lied to. We all believe some lies. Shit, I've been gaslit in my life and didn't realize it until like I was right in the midst of it. So it happens. We all get fooled. And the biggest fools out there are the people running our world. So for your information only, you do what you want with this information. I'm going to continue on reading through the list of side effects and what those side effects actually are. You can learn more about those side effects all that you want by going on the internet, of course, or looking in medical journals. But I'm just giving you cliff notes of what that side effect is. That's it. And you can have a great laugh at my mispronunciation of all these medical terms. That's it. It's a good time. I'm trying to make these videos short, but a little bit longer because what I am aiming to do is get half a page of side effects done in a video. So that we're doing one page in 2 videos as opposed to a multiple series of videos per page. I'm just finding it's taking way more work than I actually anticipated. And we are only on page 2. When I finish with these symptoms today, we are almost at the bottom of page 2. But because of my laptop dying yesterday, I didn't get to finish researching probably about 25 symptoms that I was going to include in this video. So we're going to start at 160 where I left off, and we're going to move into the 200s. And then my next video will be like the tail end of page 2 of symptoms and moving on to page 3. So right along here, we're hopping into autoinflammation with infantile. Oh, I must have spelled that wrong. And there, I bet you it's enterocolitis. An autosomal dominant disorder characterized by onset of recurrent flares of autoinflammation in early infancy. Autoinflammatory disease, problems with the innate immune system's reaction. Automatism epileptic, non-purposeful, stereotyped, and repetitive behaviors that commonly accompany focal impaired awareness seizures. Autonomic nervous system imbalance, characterized by a hyperactive sympathetic system and a hypoactive parasympathetic system. Autonomic seizures, a simple focal seizure with autonomic symptoms which affects the part of the brain responsible for involuntary functions. Axial spondyloarthritis, an umbrella term for types of inflammatory arthritis that primarily affect the spine and sacroiliac joints that connect the lower spine to the pelvis, resulting in pain in the lower back, hips, and buttocks. Axillary vein thrombosis, acute swelling and pain in the upper limb due to occlusion of the auxiliary and or subclavian veins of thrombus. Axonal and demyelinating polyneuropathy is a rare neurological disorder in which there is inflammation of nerve roots and peripheral nerves and destruction of the fatty protective covering of the nerve fibers known as myelin sheath. Axonal neuropathy, an inherited condition characterized by abnormal, large, and dysfunctional axons called giant axons. Hey, also, now we're moving into B's. So we're out of the A's now. Whoop, whoop. On to B. The first B symptom at 169, bacteriocytes. So this is actually a shot given to patients who have a degree of liver insufficiency. So I'm not really sure why that was listed as a side effect and not the actual side effect. So that's what I got. Baltic myoclonic epilepsy causes involuntary muscle jerking or twitching. Band sensation. Now this was fun because it kept trying to just bring me to this, like there's a band actually called Sensation. I don't want to know about this band. Anyways, band sensation. This is an injury typically caused by a repetitive action such as biking, running, cycling. Baystow's disease happens when the thyroid gland produces too much thyroid. I gotta scroll and I need both my hands for that. Basilar artery thrombosis is a devastating stroke. Basophilopenia, body produces too much basophilopenia, body produces too much basophil. Behçet's syndrome, disease that causes blood vessels throughout the body to swell. Benign ethnic neutropenia, observed in individuals of African descent and is characterized by a reduced absolute neutrophil count. Benign familial neonatal convulsions. It's a recurrent seizure in newborns. Benign familial pemphigus, also known as Hailey-Hailey disease. It's a rare skin condition that usually appears in early adulthood. Benign Rolandic epilepsy causes seizures in children between 6 and 8. Beta-2 glycoprotein antibody positive, which is a diagnostic criterion for antiphospholipid syndrome. Bickerstaff's encephalitis, autoimmune disease of peripheral and central nervous systems. Bile output abnormal output for bile output decreased. Bile helps us digest our food, as we know, and if we have a deficiency in the production and or release of bile, you can actually develop other health-related issues. Biliary ascites often occur after a complication from biliary procedures. Bilirubin conjugated abnormal and increased, which is an indication of hepatobiliary disease. Bilirubin urine present, which is an indication of liver disease. Biopsy liver abnormal, indication of potential liver disease. Biotinidase deficiency, body is unable to recycle the vitamin biotin. Birdshot chorioretinopathy, which is a painless eye condition in which color spots appear in the retina. Blood alkaline phosphate abnormal and increased, may indicate a health concern with your liver or gallbladder. Blood bilirubin abnormal or increased, may indicate liver disease or damage. Blood cholinesterase. Blood cholinesterase. Abnormal decreased, indication of excess absorption or organophosphate say that again. Indication of excessive absorption of organophosphate compounds. There we go. Blood pressure decreased, which can cause dizzying and fainting. Blood pressure diastolic decreased and systolic decreased. Low coronary artery pressure, a drop in systolic pressure can be dangerous. Blue toe syndrome, a restriction of blood supply to the feet, causes the toes to turn blue or violet in color. Brachiocephalic vein thrombosis, a blood clot which forms deep within a vein. Brainstem embolism, a blockage obstructing the flow of blood to the brain. Brainstem thrombosis, blood clots in the brain. bromosulfathalin test is bromosulfathalin bromosulfathalin test abnormal, indication of liver failure. There we go. Bronchial edema, excess fluid in the lungs. Bronchitis, which is an inflammation of breathing tubes. Bronchitis mycoplasma, an infection in the bronchial tracts. Bronchitis viral, caused by a virus versus a bacteria. Bronchopulmonary aspergillosis allergic, which is a form of lung disease in which it occurs through those that are actually allergic to the aspergillus. Bronchospasm, a tightening of the muscles that line your airways. Budd-Chiari syndrome, hepatic veins are blocked. Bulbar palsy, set of conditions which occur when the lower cranial nerves are damaged. Butterfly rash, raised rash across the bridge of the nose and the cheeks. C1q nephropathy, kidney disease where large amounts of protein are lost in the urine. Cesarean section, an incision made in the lower abdomen to deliver a baby. So obviously women who are fully vaccinated, cesarean sections can happen for many reasons. I'm just going to say that it's not necessarily that the COVID-19 shot is causing women to have cesarean sections. It's obviously happened in the sense that however many pregnant women, and it could have even just been one, got fully vaccinated, and it caused her at labor. It's nothing about going into early labor, but it caused her at labor for whatever reason, instead of being able to give natural birth, to have a cesarean section. So it doesn't tell us why. It just lists it as a side effect. Calcium embolism, an accumulation of platelets, cholesterol, and fibrin with traces of calcium. Capillaritis, a skin condition in which red and brown patches or spots form on the skin. Kaplan's syndrome, swelling and scarring of the lungs. Cardiac amyloidosis, deposits of abnormal protein in the heart. And cardiac arrest today will be our last symptom, and that leaves us at number 216. And we all know what a cardiac arrest is. It's where the heart stops beating suddenly. So I will continue on my journey of researching what each side effect is. Researching. It's not researching. It's the wrong word to use. Reading. Researching implies a whole other connotation of work that I am not doing. I am not compiling data and comparing and, referencing sources and interviewing. Yeah, I'm just not. I am literally looking at medical journals and the good old Google machine to find out what these side effects listed actually are. Some are obvious, like cardiac arrest and bronchitis and pneumonia. Like, we all know what those are. But things like Kaplan syndrome, or cardiac ventricular thrombosis, or cardiogenic shock, or cardiolipin antibody positive. Like, there's so many things out there we've never heard of, for most of us, if we're not working in the medical field. Obviously, if you're a nurse or a doctor or practitioner or midwife even, I'm sure you've heard a lot of these different side effects. But yeah, that's where we're at for this video. I hope everybody's starting off their week in a positive fashion. I know this might not seem positive, but knowledge is power, and I believe that having knowledge is a positive thing, whatever that knowledge might be. You might not agree, or it might not even be a happy, positive piece of information or education, but knowledge is power, and I see the positivity in knowing. That's all. Have a great week, guys.